So just some of the results very briefly to give you an idea of what we found. So all I'm going to show you today are just the results with regards to the white light illumination of our copper titania composite. So we have about, So we have about 10,000 cells per 100 microliter of phosphate buffer saline solution that was put on the surfaces to actually start the process, and then we shone light upon the surfaces. And if you look at my chart here, you'll see that I have a curve of the amount of bacterial cells in cell-forming units, which is equivalent to about, say, 1 cell-form unit is equal to 1 bacterial cell approximately. And this is a time in hours on the x-axis here. And the broken line here on this curve, this represents the results as a result of white light illumination. The solid line represents our surfaces that were held in a dark chamber. Now, as you can see very nicely, we do get significant decay or destruction of bacteria as the time passes. As you can see, we do have less destruction of bacteria whenever we hold the samples in the dark chamber. And you do see some weird things going on with the curve here. And this is indicative of the fact that because we're not killing bacteria fast enough in the dark chamber, we are having some difficulty recovering all the bacteria from the surfaces, so then our error tends to increase. And that's the reason why I wanted to show this, because this just shows some of the issues that occurs as a result of working with the dark chamber in terms of the destruction of bacteria. I should underline also that the copper is also killing bacteria in this case, and that's why in the dark chamber the number of cells also decreases nicely, because I am getting some antibacterial activity. But one should note, I'm only working with 5% of copper. So that's just a note that I want to bring to light. We did go ahead and work with conventional, regular TiO2 mixed with copper and made a coating out of that. And you can see also, again, significant decrease in the amount of cells that we have. Now, one may be asking, well, why not just go with the cheaper conventional TiO2 and be done with it? You know, I may have to pay more money for nano. But you should understand that from our work, not shown here, the nano TiO2 coatings tend to have lower porosity, so then you get lower liquid penetration of these bacterial solutions. The nano TiO2 coating has high hardness, which is indicative of improved wear resistance. So, and the cost is not, significantly different, but, you do get some benefits with the nano-based coatings. Just to be a little bit more thorough, we did look at cells recovered from a pure copper plate whenever we put our samples on that. And as you can see, again, significant decrease in our number of cells as a result of exposure to white light, but also mainly because copper does have antibacterial effects itself. Now, I should point out very quickly that in this case, this is a pure copper surface here, which may tend to be more expensive than depositing a 300 micron thick coating. We're seeing some very interesting effects here. And we also did the same thing on stainless steel, just to show that cell death, whether or not you shine light on stainless steel, the cells do not get destroyed. You're seeing the effects of the copper and the TiO2 very nicely. Okay. And very quickly, in terms of why TiO2 actually destroys bacteria, it is because we have a material phase known as anatase within the microstructure of our coating. There is no brookite, no suboxide phases, no amorphous phases. We have pretty much rutile and about 9% anatase, which is responsible for the photocatalytic activity that we see. And in conclusion then, I would just like to wrap up that, though we are seeing some significant destruction of bacteria, we would like to improve the work a bit to reduce the time it takes to kill the bacteria. So there's future work that still needs to be done. Additional work needs to be done to, quantify the wear resistance that we get on these coatings as a result. So, future collaboration is always open with the microbiologists and the chemists in the room. And I believe that this is possibly a financially attractive solution to the destruction of bacteria on surfaces. And if I can just add very quickly, we do have other biomedical coating projects going on. One of them involves the development of a flame-sprayed titanium alloy bioglass composite coating for use as an implant coating to promote bone fixation in implants and to promote the development of hydroxyapatite, which is indicative of biomineralization on surfaces. So we've been getting some very positive results, and again, we're always open to discussion and to potential collaboration in this area also. I do have copies of journal paper available on my presentation today, so if you'd like one, I'd be more than happy to give you one. Thank you so much for your attention.